We had the first microinsurance national conference ever in New Delhi in 2003. Lots of workshops, and I already mentioned the parliamentary committee and so on. So I think I'll stop here.
Thanks, Mirai. The journey of 25 years in specifically microinsurance and micro-health insurance, not just in India, but I guess all across the world. I don't think any other organization would have that much of rich experience of 25 years of working in this particular area. Before we go on to Meda, I just have two questions for clarification. You talked about VimoSewa being a mutual, and you also talked about the risk being hived off. So from my understanding of a mutual would be something that the risk is being carried within the mutual, and you talked about the risk being hived off. So do you mean that you have insurance companies to underwrite the risk? The second question is more in terms of awareness, and that has been, I guess, a biggest challenge for all of the insurance, all of the social sector which is planning to work on insurance, and that has been an area where most of them have not been able to have deep pockets to invest. Neither is the insurance company doing it, nor is IRDA doing it. So how do you overcome that part of it? So if you can just answer these questions, or do you want to answer it later?
So as I said, we kept evolving as we went along. So for the most part, we are an intermediary. Under the laws of the land, IRDA's laws, you cannot be an insurer even if you do all that we do, unless you have these 100 crores. So we are an intermediary. We are several things all at once. We are an intermediary for some of the insurance companies on health insurance. The company we work with is New India Assurance, NIA. Then we are also a micro-insurance agent for Life Insurance Corporation of India. And the third, what we are is also a mutual. That's in the last 5 years, through the cooperative framework, of course, but we developed our own product, which is for wage loss, as I mentioned, Saral Suraksha Yojana, which matches with RSBY, and for that we are carrying the risk. So we wear all three topis. So that is question number one. And the second was? Awareness. Yeah. So we were very fortunate in 1992 to have a collaboration with the German technical agency GIZ, and they gave us a fund, and we invested that fund. It was 1 crore of rupees in 1992, and from the interest of that fund, we used the interest for education. And then we also raised some project-based funding for the first couple of years. But we were fortunate that we had a strong grassroots base already on the ground. So if you will, we could piggyback on that, go among our members, and through different methods that we all use. In Gujarat we use Bhavai, we use Sharing Natak, we do so many garbas, and we explain about insurance through these methods.
That's a great input, because most of the micro-health insurance with the MFIs really didn't take off. But today I doubt if many of the MFIs actually have a micro-health insurance product that they are taking to the community. And one of the biggest challenges, I believe, has been investment. So in creating awareness. So that clarity in terms of seeking out funding other than the insurance itself to create awareness is a very, very important point. Now to go to Meda and Annapurna. She has been in the forefront of a mutual model where I believe they carry the risk internally, and they do most of the underwriting themselves. So it's going to be very exciting to know how that has been working, and I know that you've been having 20 plus years of experience of doing this. And it's the same questions to you again, Meda. What made you go on this journey, being an SSG, transitioning to microfinance, and in spite of transitioning to microfinance, you've still kept on the journey of micro health insurance?
Thanks Mukti and Mirai. Just